Let's talk a little bit about some very new technology now, the plasma portrait. The plasma portrait is something that's been out slightly more than a year, and it does wonderful things to the surface of the skin. It can be used to treat facial wrinkles. It can be used that occur around the eyes, around the lips, and in the cheeks. It's similar to laser resurfacing, but with laser resurfacing, one of the problems that can occur is that you can't necessarily you have to do the entire face with most laser resurfacing. If you're going to take off the outer portion of the skin, you may get differences in coloration, so you can't select, say, the lips. And if someone just has lip lines, just do the lips and get rid of the lip lines. You have to end up doing the whole face because there may be a color difference with laser resurfacing from the lip lines to the skin next to it. Whereas with the portrait, you can do just a small area if you want to, and there's no detectable skin coloration difference. It's what the portrait is it's a high energy pulse of ionized particles. It's the fourth form of matter, with solid, liquid, and gas being the first three, and now plasma. Same as a plasma screen TV. Gas particles are being highly excited, and they shoot out, and they come out in out of this little crystal, and we fire little pulses at the skin, and those particles treat the surface of the skin, and then they penetrate 0.5 millimeter to 1 millimeter down into the skin, so they also treat underneath, and that stimulates collagen growth. So they're great for wrinkles, fine lines, and for skin tightening as well. They also are very effective for acne scars, brown spots, and melasma. Melasma is the dark brown pigmentation that occurs in women, often with pregnancy, and is very, very difficult. It's one of the toughest things to get rid of when it comes to treatment. With Photofacial, we always check with a light if we're concerned it might be a melasma, because you can't always tell the difference between melasma and just sun damage on the skin, but we have a special light that'll detect the difference. The portrait stimulates collagen to grow, and that fills in the lines, creating a thickening of the collagen layer. There are 3 ways to do the portrait. It can be done as a micro treatment, which involves 3 to 5 treatments where there's a little bit of mild redness, but little or no downtime. Or it can be done as Portrait 1, which is 3 moderate treatments, where the skin turns red and peels in 2 to 4 days. It's a light peel. It's not a heavy peel. Or the Portrait 3 is looks more like a laser peel, but maybe not quite as intense as that. It's much more aggressive. You only have to do 1 is the big advantage, and it takes 7 to 10 days for the skin to return to normal appearance. You see some immediate reduction in the pore size, but the full results are not seen for about 6 months. What we see again is decreased wrinkles, reduction in acne, pits and scars, tightening of the skin, and a more youthful overall look. So an example might be a 48-year-old with browns and acne scars, and this is actually a real patient that came to us. She had browns, acne scars, and some loosening of her skin. And with the portrait, we were able to tighten her skin, help fill in the acne scars some, and markedly improve the brown spots. So here's an example of how it can help fine lines around the eyes. So you can see these were treated, and here's the after effect. This is just three weeks later. Another patient who had her cheeks treated before and after.